You know, we always think about high blood pressure as like an adult thing, right?
Right.
But it's becoming more and more common in kids, which is kind of alarming.
Definitely.
So that's why we're doing this deep dive on hypertension in children, breaking down this article from TheEMTSpot and like really getting into it.
Sounds good.
So no worries, we're not going to get all medical jargony on you.
No, not at all.
We want to make this practical, something you can actually use.
Exactly.
So, first things first, the article defines childhood hypertension as blood pressure that's consistently at or above, get this, the 95th percentile.
The 95th percentile.
Yeah, and that's for a child's age, height, all that.
Makes sense.
And it takes 3 separate visits, 3 separate readings to, like, confirm it.
3? Wow. Wait.
Yeah, so it's not just a one-off thing.
No, it's definitely a pattern.
Exactly, a pattern.
And that 95th percentile, that's important.
Why is that?
Because it means we're comparing your child's blood pressure to a whole bunch of other kids their age.
Oh, I see.
So if they're consistently in that top 5%, that's when it's like, okay, we need to look into this.
It raises a red flag.
Exactly.
So we're looking for a pattern, makes sense, but then the big question is,
The why.
why?
Why is it high?
Exactly. Why is the blood pressure elevated?
And that's where it gets really interesting.
Okay, tell me more.
So the article talks about 2 main types, primary hypertension and secondary hypertension.
Okay, and primary, that's the one where they don't know the cause, right?
Right. Primary's like, it's a bit of a mystery still.
A medical mystery.
Kind of, yeah.
So that's the more common one, right?
Yeah, it's more common in kids and adults, actually.
Huh. Interesting.
It might be because, blood pressure regulation's complicated.
Yeah, I bet.
Lots of factors involved, genes, environment. We're still figuring it all out.
So primary hypertension is kind of a waiting game. Still so much we don't know.
In a way, yeah.
But with secondary hypertension, you can actually pinpoint the cause.
Exactly.
The article mentioned a few, like, kidney problems, which makes sense to me.
Right. Kidneys play a big role in blood pressure.
But then it also mentioned adrenal gland tumors, and I have to admit, that one threw me for a loop.
Adrenal gland tumors.
Yeah, I was like, what?
It sounds scary, I know.
It does.
But basically these glands, they produce hormones, right?
Right.
And those hormones, they can affect your blood pressure.
Okay, so a tumor messes with that whole process.
Exactly. It can disrupt the hormone production, and that throws your blood pressure out of whack.
Wow. So these little glands have a big job.
They really do.
So finding that root cause, it's crucial.
Absolutely.
Especially for treatment, right?
Huge, because how we treat primary hypertension versus secondary, it's totally different.
Okay, so big difference there.
Big difference.
Okay, so wow.
Yeah.
Finding that root cause is so important.
Absolutely.
Especially when it comes to treatment, we've established that.
Huge.
But now I'm kind of stuck on this whole thing about symptoms.
Oh, yeah.
Because the article mentioned that sometimes there aren't any.
That's the thing, right?
Yeah, it's like a silent threat.
Exactly.
And that just makes those regular checkups
So important.
so important.
Even if your child seems healthy,
Yeah.
because if we don't catch it,
Right.
untreated hypertension, it can lead to all sorts of problems down the line.
Like what?
Heart disease,
Oh, wow.
stroke, kidney problems.
Okay, so those are serious.
Yeah, long-term consequences.
We definitely want to stay on top of this.
Exactly. Prevention is key.
So regular checkups, non-negotiable.
Absolutely.
But let's say there are symptoms.
Okay.
What should parents actually be looking out for? Because I'm drawing a blank here.
Yeah. It's tricky because they can be pretty general
Like what?
headaches,
That's
pain.
Kids always have that.
I know, right?
Yeah.
Vision changes, nausea, vomiting, that kind of thing.
So basically it could be anything.
Pretty much.
Easy to miss.
Exactly. Hence the checkups.
Right, right.
Although the article did mention some more serious symptoms.
Oh, like what?
Things like seizures,
Oh, wow.
pain,
Okay.
rapid heartbeat.
So if those happen,
That's when you know it's serious.
red alert.
Yeah, that could be a hypertensive crisis.
And that's what we're trying to avoid.
Exactly.
Okay, so we've covered causes, symptoms, or the lack thereof.
Right.
But what can we actually do about it?
Okay.
Like, what are the solutions here?
The article talked a lot about lifestyle changes.
Okay, so that's the first line of defense.
Exactly. It's all about making healthy choices.
Makes sense.
And these are good for all kids, not just those with hypertension.
Right, so it's like setting them up for success.
Exactly.
Okay, so what does a healthy diet for blood pressure even look like?
Sure. So
Because it's got to be more than just telling kids to eat their veggies, right?
it is. It's about the bigger picture. So we're talking about lots of fruits and vegetables,
Of course.
whole grains,
Okay,
lean protein,
got it.
low-fat dairy,
So like the building blocks of a healthy diet.
Exactly, giving their bodies the best fuel.
Makes sense?
And along with diet, reducing sodium is important.
The salt top.
I know, everyone's favorite.
Right.
But our bodies do need some sodium.
Right. That's what I was thinking.
So it's about moderation.
Okay.
And that's where your child's doctor comes in.
To figure out the right amount.
Exactly. They can give you personalized guidance.
Personalized. I like that.
Right. It's not one size fits all.
Okay. So we've got diet. What about exercise?
So important.
How much are we talking here?
It doesn't have to be intense.
Okay, good.
Just regular physical activity.
Like what?
Playing outside.
Okay.
Riding bikes.
Dancing.
Fun stuff.
Exactly. Make it fun.
Way more likely to stick with it.
For sure.
Okay. What else? The article also mentioned weight.
Yes. Maintaining a healthy weight.
That can be a touchy subject.
It can.
How do we even approach that?
With sensitivity.
Of course.
And involve your child's doctor.
Okay.
They can help assess the situation.
Right.
And provide guidance.
So it's a team effort.
Exactly.
Parents, kids, doctor, all working together.
Absolutely.
Okay, this is good. This is helpful.
Good, I'm glad.
So we've got lifestyle changes, but what about medication?
Right, so
we've got lifestyle changes, but what about medication?
right, so sometimes medication is necessary.
Okay, to manage the blood pressure.
Exactly.
The article mentioned a few different types.
It did.
ACE inhibitors, ARBs, those are common ones.
CCBs, thiazide diuretics.
Yep, all used for hypertension.
But I have to admit, those all kind of went over my head.
That's okay. It's a lot to take in.
Do parents really need to know all the ins and outs of how those work?
The most important thing is to talk to your child's doctor.
They can break it down.
Exactly. They'll explain everything, how it works, potential side effects.
Okay, so again, back to that open communication.
Exactly. Your child's doctor is your partner in all of this.
Makes sense. So it's not just about the medication itself. It's about that guidance.
Absolutely.
Okay, so we've talked about causes, symptoms, management, prevention, everything.
We've covered a lot of ground.
But I think the big question is, what's the long-term outlook?
Right. What can parents expect?
If their child is diagnosed with hypertension.
Because the article was pretty upfront about the risks.
Yeah, it didn't sugarcoat it.
Untreated hypertension can lead to serious problems down the line.
Heart disease, stroke, we talked about those.
Exactly. And kidney problems, too.
So those are some pretty scary possibilities.
They are, but
There's a but.
there's always a but.
It's not a foregone conclusion.
No, not at all.
Early intervention is key.
That's the most important message.
Catching it early can make all the difference.
Absolutely. It can drastically reduce those risks.
So it's not about living in fear of this diagnosis,
No, it's about empowerment.
using it as a springboard for positive change.
Exactly.
And the good news is we have control over a lot of these factors.
We do, especially those lifestyle changes we talked about.
Right. It's like we're setting them up for a healthier future.
Think of it as an investment in their long-term health.
I love that. An investment.
And it's not just about telling them what to do.
Right. It's about showing them.
Modeling those healthy habits ourselves.
Because kids are smart. They pick up on that stuff.
They totally do if we're telling them to eat veggies while we're snacking on chips.
They're going to call us out.
Exactly.
So lead by example. Make it a family affair.
It's the most powerful thing we can do.
It all comes back to those small, everyday choices.
Consistency is key.
I think that's a great place to wrap things up.
Yeah, I agree.
We've covered a lot today about childhood hypertension.
Causes, symptoms, management, the whole 9 yards.
And I think the biggest takeaway is that knowledge is power.
Absolutely.
Arm yourself with information, talk to your child's doctor, and don't be afraid to ask questions.
You're not alone in this journey.
And there's always hope.
Always.
So on that note, thanks for joining us for this deep dive.
It's been a pleasure.
And remember, you've got this. We'll see you next time.